Hello, my name is Leonor Calhas Pinto and I'm the focal point of Directorate General of Health Portugal in the Health4EUkids Joint Action. Welcome to Unit 2.2.1, Grünau Moves Planning the Intervention. Selection of the intervention area, a contribution from Portugal. Where we live shapes how we live, especially for children. A child's neighborhood can nurture health or limit it. That's why choosing the right area for intervention is not just the first step in a health promotion project. It is a strategic and ethical decision. This choice must be grounded in a participatory and structured local diagnosis, one that identifies barriers and opportunities to promote healthy lifestyles, not only for the children, but for the whole community. The context, why this matters. In Europe and across the world, children from low-income communities are more likely to grow up overweight or obese. But obesity is only the surface. It reflects a deeper imbalance, a mismatch between the environment children live in and what they need to grow healthy. Obesity increases the risk of chronic disease in adulthood, like type 2 diabetes, cardiovascular disease, and even cancer. It also impacts children's mental health. Social isolation, bullying, and low self-esteem are common among overweight children. But this isn't just about food and exercise. It's about the commercial, political, and social determinants of health. A web of conditions related to income, education, employment, housing, and access to services. These factors can determine health outcomes. That's why promoting healthy lifestyles require integrated long-term strategies, combining education, urban planning, public policy, and strong community engagement. Frameworks like the one proposed in Portugal guide these efforts through a four-stage cycle: diagnosis, planning, implementation, and evaluation, ensuring interventions are grounded, flexible, and community-centered. Many of the environments children grow up in today are considered obesogenic, settings that promote excessive calorie intake and discourage regular physical activity, ultimately increasing the risk of overweight and obesity. Imagine a neighborhood with no fresh produce stores but several fast food outlets, where sidewalks are broken, parks are far, and streets are unsafe. These conditions shape daily habits, not by choice but by design. In schools, the food landscape also matters. What's offered in canteens, vending machines, or nearby shops influences eating behaviors. Meanwhile, the design of schoolyards, the availability of playgrounds, and the culture around movement influence physical activity levels. That's why tackling obesity isn't just about changing behavior, it's about changing the conditions that shape behavior. So, how do we choose the right area for the intervention? We look at three layers of indicators. The first, socioeconomic indicators, such as low education levels, high employment or precarious jobs, low household incomes, poor housing conditions, and composite deprivation indices. The second are health indicators, like prevalence of child overweight and obesity, sedentary behavior and physical activity rates, incidence of nutrition-related diseases. Quantitative data should always be complemented by participatory diagnosis, bringing in schools, families, and local leaders and health professionals to capture lived experience and contextual insights. And the third are opportunity indicators, such as political will and support, existing community or health projects, civic engagement and participation forums, social cohesion, and history of collaboration. We also need to assess whether there is a minimal level of readiness to support an intervention. School openness, active local authorities, and institutional partners like public health units. The diagnostic process should map existing resources, current practices, community assets, and key stakeholders, allowing for tailored, community-driven strategies that promote healthy lifestyles. Working with what we have. In some areas, especially rural or highly deprived ones, data might be limited, but this should never be an excuse not to act. Systematic studies consistently show a social gradient in obesity and inactivity. The more deprived the setting, the worse the health outcomes. So, if we know a community shares those structural conditions, we can reasonably extrapolate the data and move forward. Nevertheless, it is essential to carry out a local diagnosis to ensure that the planned actions are appropriately tailored to the specific needs and the context of that area. A case study from Portugal. In Portugal, we applied this process in two municipalities, Alter do Chão and Porto Alegre, different in setting, rural and urban, but united by shared socio-demographic and cultural factors. We start by meeting local leaders, municipal councils, health authorities, and school coordinators. Their involvement wasn't just symbolic. It laid the groundwork for a community ownership of the intervention. This multi-level engagement ensured that interventions weren't just top-down. They were built with the community for the community. Although where one of the areas are rural and other more urban, both face similar challenges. Health was not always seen as a top priority, time constraints in schools, and limited access to healthcare resources. But there were powerful opportunities too. Cultural proximity made collaboration easier. The scale of the towns allowed for agile coordination. Strong local networks helped build trust. From a strategic standpoint, Portugal's involvement in this initiative carries broader national significance. These pilot projects serve as testing ground for an integrated community-based methodology that could be scaled up and adapted across the country. By generating evidence, building local capacity, and fine-tuning tools and processes, Portugal is investing in a replicable model of promoting health lifestyles, rooted in equity, participation, and local leadership. Furthermore, this participation creates a valuable opportunity for international exchange, sharing insights, learning from other countries facing similar challenges, and strengthening cross-border cooperation in tackling childhood obesity. In a globalized world, building healthier communities requires both local action and international dialogue. And Portugal is positioning itself to contribute to and benefit from both. From selection to action. Selecting the intervention area isn't just about identifying the problems, it's about spotting potential. So we recommend starting with available data, but not being paralyzed by its gaps, prioritizing areas with both needs and local buy-in, valuing community readiness just as much as epidemiological needs, aligning with political momentum and existing efforts, building partnerships from day one, use a participatory process to map local strengths and barriers, Make the case clear to local decision makers. This is a shared investment in a community well-being. And above all, framing intervention as an opportunity for the entire community, not just for the children. Following a continuous improvement model is crucial. Set clear and shared goals, track progress with practical indicators, adjust based on what works, and celebrate small wins. They build long term motivation. Promoting health lifestyles, success depends on both strategic and flexible structure and local engagement from different stakeholders. Places shape people. And when we choose to invest in the right places, we create ripple effects across generations. So let's choose wisely, let's choose equitably, let's build environments where children and communities can thrive through healthy, active, and meaningful lives.